Let's, oh, we are live.
There we are.
Okay, I'm just going to see if we can see the, okay, now, I think now it's official. Okay, comments.
Oh, perfect. We can see comments there. Awesome.
I just wanted to see if we can put them right next to our faces, but I guess not.
Okay.
Okay.
Let's see them as they go up.
So, welcome Tenielle. This
Thank
is
you.
her last time joining us in the Facebook group to talk about newborn safety. And if you have missed any of the other live calls that she's done with us, I really encourage you to go onto the YouTube channel, Mom Talk Educate, and there's a whole bunch. There's at least two, I think we did already, or three. I've had you on at least three. This is number
That's right.
four,
This
I
is
think.
4, I think. Yeah.
So Tenielle MaGee is the collaborator with me on our newborn safety course that is going to be live for sale on Monday with the early bird price. And I'm just going to let Tenielle introduce herself.
Yeah. Good morning, everybody. My name's Tenielle MaGee, and I'm a physiotherapist in Alberta, Canada. And I've been a physiotherapist for coming up to 23 years. I've always worked in direct patient care, and I've worked with infants all the way up to adults, a variety of orthopedic and neurological conditions. I own my own clinic as well, and we have 24 employees there, so we have quite a large clinic, and so we see quite a variety of all sorts of conditions. And I also have a second business called Navisass, where we work in work safety. So we go into a variety of different type of people, specialties from construction to oil and gas to office settings, all sorts of different settings. We review safety protocols, we talk about ergonomics, and we try to create safer spaces, as well as we do injury management and prevention. So I do a variety of different things, and this has been really fun to collaborate with Catherine on this type of course, which we mostly talk about all the different parts of safety for newborn photography specifically. And so it's really exciting. So we've went into just typical things that you'd see, such as different reflexes that you'll see in all of the babies that you see. And then we get into some medical conditions where we're talking, sometimes a little bit about very specific medical conditions, but overall, the overarching theme in terms of like all the questions that you should ask and all the things that you should have into place. We also get into lots of different things in business. So we talk about everything from insurance to taking first aid and CPR, and then how to set things up, whether you're mobile or you have a space, all the considerations that you should have. And then we get into all the stuff that Catherine does, which is all of the things that you do before someone gets in and they come, and all the questions that you need to ask. Then we go into sanitization and cleaning and all of those protocols that you should have into place. And then we talk about all of the, medical conditions with each pose, or safety considerations, when you should use a composite, all of these types of things. And at the end, we talk about the different types of posing tables. So whether you're using the dog bed, bean bag, or the posing table, and all the different considerations you should have considering all of those. Changing ergonomics to make it better. Specifically, the thing that I see the most is that photographers are bent over and it's really hard on their back. And so this is, if you're learning anything, save your back, and we can do this safely and effectively. And we also talk about just taking care of yourself in terms of a pre-stretch program before you're doing this photography, and then desk setups too when you're doing all your editing. So it's a variety of different things.
Yeah, my mind is kind of blown. Like I knew that I knew what I was doing with newborn photography, but Tenielle brought all of the medical aspects to everything and explained why things could happen, or that sort of thing. And I was like, oh my gosh, I've learned so much, and I've been doing this for 13 years. So honestly, every single person who grabs this course is going to be so happy, because it just covers literally everything. Everything.
Yeah, for sure. And what I want you to know is, after you've done the course, I want you to feel more confident and better. I don't want you to feel more scared, right? Because sometimes we go, oh, I'm doing that wrong, and oh, I'm doing that wrong. And it's not about right and wrong ever. Safety is not about right and wrong. It's just about actually thinking about it
Mm-hmm.
and making better decisions. And so even the smallest tweaks that you can do to make things safer for you, for baby, for family, for business, the
Mm-hmm.
better off you're going to be. So why wouldn't you invest your time in doing this, right?
Absolutely.
Yeah.
And prevention really is like the ultimate goal. Preventing injury with an infant, preventing a bad situation from happening, preventing your own self from going through back spasms, and preventing tendinitis and carpal tunnel, like preventing using harsh chemicals that could actually give respiratory distress, like preventing all of those things. If you know how to prevent them and implement the safety protocols that this course will show you how to, your life is just gonna be a game changer.
Yeah,
so.
for sure. I was just talking with Catherine this morning because in the city where we're in, we are currently experiencing a measles outbreak, which is very unusual. So we just talked quite a bit about cleaning versus sanitizing and all of these things and how you're doing things. And so this is something that we do get into in the course, but it is something that I think most people do wrong. So cleaning is actually just removing dirt, debris, and maybe some pathogens off of a surface, whereas disinfecting is actually killing bacteria and germs completely. So these are two different reasons why you'd be doing this. And so obviously just good old soap and water will clean something, right? We don't necessarily need to do that. But what I see people do at home and at their office and everything is they just spray, a Lysol cleaner everywhere and then just wipe it off.
Well, that's what I was doing. Like I had no concept of, anything really, because like I don't understand that stuff. Like I'm just the average person. Like I haven't gone through medical training of any sort. So to understand all these words and everything like that. So Tenielle, can you just break it down? Even let's just talk about Lysol. Because
sure.
What you came in this morning with Lysol information, I was like, oh my gosh, that's what I use on so many things is Lysol.
So I would say the majority of people will just buy something because that was what was on sale on the shelf, right? So Lysol is a common one that we know. So this morning we pulled up the safety data sheet for Lysol, and we can pop it in the comments afterwards. But the safety data sheet is actually 15 pages long for Lysol.
Just crazy.
There are the protective methods is that there's hand protection, there's body protection, and respiratory protection. So they're actually, even though it is a fairly safe product compared to some other things, there is risks of respiratory issues when using Lysol products. So this is not a product I would recommend spraying while a newborn is in the area, because you're not, it's just too unsafe.
So, okay, I'm going to stop you there for a second. So, most of us would have already used it before the infant arrives, but if you're spraying it, those chemicals can stay in the air.
They can stay in the air.
So that's something to think about. So you might think, oh, well, don't worry. Everything's done clean before the client even arrives. I'm not going to be spraying Lysol while the baby's in the room.
That's right.
But if those little particles are in the air and then an infant is going to be arriving,
exactly. It's just something to consider. So, I always recommend before you use a product, you're researching the product and you're not doing it based on what it cost or, the advertising. You go into that safety data sheet and you take a look at this and you go, okay, so these are the adverse effects that are going to happen. We're just reading through this. So it may include respiratory tract infection and coughing. So that seems to be with Lysol, what the safety data sheet is saying is that inhalation of these chemicals and toxogens could cause respiratory tract infection and coughing. So is this the chemical you want to use?
Probably not.
Probably not.
And I have asthma, so that's really a no-no.
Yeah, absolutely.
We have a comment here. Let's just
for
see.
sure.
Oh, good morning. Okay. Sorry, you guys. The comments finally popped up.
Yeah.
Hi, Nicole. Hi, Tamara. Hi. The other Nicole. Can you guys do me a real favor? We're going to answer your questions in just a second, but anybody who's tuning in, can you guys give us a heart emoji or a thumbs up or something, just because
so we know that you're there.
We're going to get more into the algorithm if Facebook sees that people actually want to watch what we're talking about.
Yeah, for sure.
But Tamara wanted to know, what about Lysol wipes on hard surfaces?
Sure. Great, Tamara. That's actually what I was going to say next, is that obviously wipes, I would say I would prefer those to a spray, because then you're eliminating the respiratory issues. And so Lysol wipes will have a different safety data sheet than the actual spray does. So depending on that. And so you can go through, if we look at the hazardous material information system, Lysol's actually showing up as a 1 on a scale of 0 to 4 in terms of minimal hazards. So it is only a 1, it's not a 4, but it's a 4 for it being inflammatory. So
you're kidding me.
Nope.
Oh my gosh.
So you better have a fire extinguisher if you're using Lysol, because it's actually highly flammable.
Oh my goodness.
So again, just things to think about ahead of time. So we were just talking about what I use at my clinic, and I use I'm not selling this, I have no relation to it, but I use a chemical called Oxiver TB, and you can get it in a spray, but you can also get it in a wipe. And
I'm actually gonna grab, you texted me the link, and I'm just gonna grab it and post it in the chat, just because I know that I was like, well, I don't know what to buy, because I'm afraid of buying the wrong thing now. So
yeah, for sure. So the Oxiver is, again, you can get it in a wipe form, and so again, wipe forms are better. Yeah, this one here is a Canadian company, but you can also, there's lots of American companies that will also sell this product. But just as an example, this is actually where I buy the Oxiver. And the safety data sheet for Oxiver is a little bit less. It's only 11 pages long, but it uses hydrogen peroxide instead of some of the other chemicals, and there is no respiratory concerns at all. So just something to consider. We've got Amanda here. She says, I love those, someone who's worked in medical. Yeah, so it definitely, for sure. As Amanda would know, there's no smell with Oxiver, and I have a couple people that work at my clinic that have asthma, and we clean everything in between every person. We're kind of high volume, and when we switch to the Oxiver, the one woman that works for me, she had way less asthma issues.
Wow.
And so and we started going in with the wipes too, so we're not actually spraying things into the air.
So with the wipe,
it's pre-wet, right? So now you're not having that respiratory.
Okay, so but does it just disappear, like the whatever you're wiping on the surface, it just goes away on its own? And
no, that's right. So what will happen is there's a contact time for every type of cleaner that you're using. So something like Lysol, the contact time I believe is 10 minutes, which means
I didn't know that either.
Leave it 10 minutes wet on the surface before it's considered clean.
Wow.
Disinfected, not clean. Sorry,
yeah, disinfected.
Yeah. Whereas Oxiver is a 1 minute wet. So you wipe it down, you leave it 1 minute wet, and then you're actually going to remove the product afterwards.
Okay.
So you're not going to leave the product on the hard surface afterwards. And so that means you've completely disinfected it, and then you're going to follow again with a wet rag, remove the product, and now I think you have the safest surface for a newborn to come in.
Perfect.
Mm-hmm. Yeah, that would be my recommendation.
Yeah, and I think that is just so good for all of us to know, like every single person. Okay, so Amanda said, what do you use for fabrics?
Fabrics, yeah. So at our clinic, we steam a lot of things. So we use high heat. If you can wash it, obviously washing in hot water is your best option. When you're looking at detergents, again, this is a whole nother area of looking at what type of detergent you're using that's going to be the safest, the least amount of, you don't want anything with any type of fragrance, right? Mm-hmm. And things like that, but something that is also supposed to clean. So for fabric, hot water, as hot as it possibly can be, is going to be your best option, or steaming. And we talked about this before. If it's not something that can be washed or steamed, the next option would be freezing, so sticking it in your deep freeze.
Yeah, which is great to know, because you know we have to think about all those things. Okay, so Nicole said, I use Norwex. Do you have information on this?
Yeah, for sure. I use Norwex as well. Norwex is, for people that don't know, it's a microfiber cloth that has some silver spun into it. And so silver is known as sort of a natural product that does also have some disinfectants. The thing that you need to know about Norwex is it does not have a DIN number, and so it does not qualify under Health Canada or FDA as an actual disinfectant. So it's a great cleaner. If you just want to clean a surface off, we use it all the time, but I would not say that it is a recommended disinfectant.
Okay. Yeah, that's perfect clarification. Thank you.
Okay,
Tamara said, what do you use to clean gowns and newborn outfits and knits? Do you recommend steamers, and what about antibacterial fabric spray like Febreze?
Yeah, I would highly not recommend Febreze. just because, again, look up the safety data sheet, but there is a lot of effects that way. So I would prefer hot water washing, whatever you can, or steaming for sure.
Yeah, so I have like a handheld steamer and I steam everything to clean, like sanitize and clean it. Anything knit, definitely steamed. And then if there was a blowout, for instance, this has happened to me, unfortunately, sometimes you'll even have the baby in a diaper. The romper is over top of the diaper and poop has shot out the sides or the back, up the back. And then you would just have a little heartbreak inside because they've just crapped in your $80 knitted romper that you're going to have to hand wash and then hand sanitize, and you want to die inside because it is possibly ruined. So that is just something that you're going to have to take extra care of, but you can definitely still sanitize it. You just might have to put some extra work into it. So I would hand wash it, try to get all the residue that I can see off, and then I guess you could freeze it technically and then steam it as the last, like, so there is 3 ways that you could go about doing that.
Yeah, I would probably not be spraying things if you don't have to. So I don't like any type of like spray that you're spraying in the air, again, just because you've got this chemical now in the air. And these little guys, especially the more premature, the newer they are, the more respiratory issues they're already going to have. So it's not that you can't use it, but why not choose something safer is, I guess, the point.
Yeah. And that's the great thing about, like, with Tenielle, she's kind of opened my eyes, as well as every person that is going to get the safety course, is that you have, because you run your own clinic, you're not just a physical therapist, you have a staff of 24, you have a lot to consider. You kind of have gone that step above and taken into consideration, okay, what is the proper and safe way to, you know, handle everything and protect my patients, your patients. And then, so that is something that we get to benefit from. We get to get her insight and her knowledge, and she's done the research. She has, you know, gone above and beyond for her clients and her patients. So now we get to benefit from that. And it's really amazing. So thank you.
Yes,
I appreciate you. You're amazing.
And that's just it, is that you're not wrong in what you're using. Like, anything's better than nothing. But again, as a sliding scale, if you can use something better and safer, that would be my choice, as opposed to using something that has more danger to it.
Yeah, absolutely. Okay, I think we have another comment. Let's just go check it out. My fingers. Okay. Do you have a steamer you prefer? Mine is handheld and it is not the best. There's so many really good handheld steamers. I would just recommend trying a different brand, honestly.
Yeah.
Costco has a really great one, and if you don't like it, return it, get your money back, and try a different one.
For sure. Yeah. Costco's great for that.
Yeah. Okay, so we have some other things that we wanted to just mention. So I have a question for you, Tenielle. So as newborn photographers, and if you're new, this is something that you're going to be doing. When you are booking a newborn client, oftentimes they are like just out of their first trimester. So they're at the very beginning of their second trimester. They're not aware of any type of medical concerns or whatever. Yeah. So a lot of times they're not going to be aware of a medical condition with their unborn child until closer to their due date. And sometimes it even happens, depending on how many ultrasounds they've had, that the baby is born with something or a medical condition that they were completely unaware of that got missed during the ultrasounds. Yeah. So I have a question for you. What if I had a client that was pregnant and they just found out that their baby was going to have like spina bifida?
Okay.
What would you recommend that I do?
We actually do a section on spina bifida, and the important thing to know is that spina bifida really ranges from almost no symptoms at all to very severe symptoms. So knowing that a child is being born with spina bifida is not enough information. You have a lot more questions in terms of, is this child medically stable? Are they still in the hospital? How long are they in the NICU? Some children that are born with spina bifida also have other symptoms such as hydrocephalus, which is increased pressure in the brain. And so they could be they could have some serious medical conditions. So all of this stuff is important. So number one, you need to wait until the child is medically stable and they're at home. You need to know if they're medically stable to travel in a car, right? Are they able to be in a car seat and travel towards you, or are you going to travel to them, right? Most likely you're going to their house, is my guess in this case. The sicker a child is, the more your disinfecting protocols and your PPE and all these things need to be in place. So I always recommend 100% of the time to wear a mask, but in the case of a child who is having more medical issues, you need to consider gloves, gowns, masks, all of the other things, as well as your proper disinfecting protocols. And so this is all stuff that needs to be in place. In this case, if the child is going to be born with spina bifida and you are not a medical professional and you have no information whatsoever, you've never dealt with this before, consider a lifestyle session. So this way the parents are handling the child and you're just photographing it.
Yeah.
Right? So then there's no posing here. You're not getting out of your comfort zone. The safest thing you could do is choose a lifestyle session. Okay.
That makes a lot of sense, because with lifestyle, and I've done a lot of lifestyle sessions as well, you can really just have the parents handle everything.
Yes. Yeah.
So in that situation, I would just make a few recommendations. I would just ahead of time just find out exactly like basically what does their day look like. Is the baby like I don't know anything about spina bifida, so I don't know if they're going to be attached to anything or if they're going to have any devices that are helping them. But I would want to know, like, what does the environment look like? So I would ask the parents to please send me some pictures of their living space. And I actually do this for all lifestyle clients just because I want to know what I'm getting into before I arrive. So I would want to know, pictures of the master bedroom, pictures of the nursery, pictures of the living room, and where the most natural light is. That has nothing to do with medical stuff, but that's just something that I would find out ahead of time for the lifestyle session. And then I would just want to know, like, is there going to be a lot of tripping hazards? Do I even have room to bring a studio light? And like Tenielle mentioned in some of her other lives, if it's not something you can handle, just say no. Yeah. You can find some recommendations and recommend somebody else that has more ability or just experience with it, and just pass it on. There is nothing wrong with you saying no to something you're not qualified or comfortable photographing.
Yeah, absolutely. And it completely depends. So there are some photographers who are used to being in the NICU and photographing babies who, they'll photograph around that. Or you may have a nurse or somebody who's used to it. They're going to have a different level of comfort than someone who's maybe brand new to photography or hasn't handled a lot of newborns in general. Then obviously the sicker the child is, the more considerations there needs to be. So if this feels over your head, that's completely okay. The safest choice is always to say no.
Yeah. Yeah.
If you need to. So there's nothing wrong with that.
Yeah.
And I would always recommend, if this is the first time you're seeing a child with a certain medical condition, tell the parents that.
Yeah.
First thing you say is, I've never photographed or been with a child with this condition. And so if you're still comfortable with me, I will work with you if you feel like you are. But the parents might just say, no, thanks then.
Yeah.
Right.
And they have the right to, and you don't take it as an offensive,
for
sure, response. So that's really, I'm glad that we talked about that. And there are so many other conditions that we discuss in the course, but that's just something that, I thought I'd bring up. I've never actually had a child diagnosed with spina bifida that I've ever worked with in 13 years. So it's probably very unlikely, but it's always like the one-off, like sometimes you're just going to get a client with a child with a very rare condition, and then these questions are going to pop up and you're going to be like, oh my gosh, I don't know what to do. So really great to consider.
For sure. And I mean, a child with any medical condition at all, respiratory, even premature, all of these things, that's when more of this PPE is more important, and the disinfecting and all of these things as well. So some people think it's like a little bit ridiculous, but if you have these protocols in place, then you can offer your services to more babies.
Yeah.
Right.
And this is like totally a different subject, but it popped into my head and I don't want to forget to talk about it. So we were talking about a few lives ago, we were talking about how when we see influencers doing things that are dangerous with newborns, and you probably know what I'm going to say, but Tenielle was mentioning how, like, okay, you want to do everything as safe as possible. And if you don't know what you're doing wrong, then how can you prevent it? But then you're displaying it all over social media. But the thing is that this course is so good because it's going to teach you how to prevent doing something that you shouldn't be doing. And you're going to know, okay, I shouldn't be doing this. And these influencers are like literally have hundreds of videos of doing things wrong. If they were to ever get sued, their lawyer has if like the lawyers that are suing them or the clients that are suing them have so much fuel, basically. Like they have so much proof of wrong that the person, like the influencer who's posting all of these videos of unsafe posing is they're not going to have a defense.
Yeah. And so we went through a few different people's Instagrams, and immediately I was like, they have long nails, they're not wearing a mask, they're using a high table, they're taking their hand off the baby.
And it's okay. I just want to interrupt. High tables are okay as long as you're doing them safely.
Yes.
But we were noticing high tables and stepping away.
And all of these things. And so it was repetitive, bad safety habits. And this is plastered all over the internet.
Yeah.
Mm-hmm.
So
something to think about.
Yeah. And like, that's not even something that even entered my mind. I was like, oh my gosh, you're right. Like if they were to get sued, they have literally shown the world how unsafe they are.
Yeah.
And I'm not saying that you should be unsafe and hide it. I'm saying don't be unsafe. And remember that whatever you see on the internet, just because it's on the internet doesn't mean that, if an influencer is demonstrating it, doesn't mean it's safe.
Yeah.
So another reason why to really cover all your bases, and the safety course is going to
Yeah, for sure. Yeah, for sure.
open your eyes.
Remember, everything you put out there is, you've put that out to the world, and you're, so you want it to be, not only do you want it to be cute and all of that, but, showing off because you've got some advanced pose is of absolutely no value to you. So I prefer, if you're considering being safe, it's not cool to try these advanced poses that that are definitely unsafe, right?
Yeah, like you can do advanced posing as long as you're doing them properly, and we explain that. And obviously, like if you haven't been trained on how to do them properly, then take a course. And and then that's honestly the best way to do it. So if you have any curiosity on where and what courses to get, drop a comment below and let me know, and I can point you in the right direction.
For sure.
Okay, so we have a few more questions. Nicole said, yes, this lack of regard for safety from some in the industry is appalling. And honestly, like it is appalling because the sad thing is that people that aren't educated have no idea. And, and even parents initially are like, oh, that's so cute, and then worst case, their child gets injured. And then they're like, oh my God, why didn't anybody tell me?
Yeah, for sure. In my industry, we see, I'm sure you've all watched them, the ASMR videos of spine cracking. So they do all these wild and crazy and very unsafe cervical and thoracic manipulations. And they video it and they put it all over the internet, and people love watching them, but it is absolutely appalling from a safety standard to watch some of these practices being, out there and millions of views, right?
Yeah. Yeah, and then it distorts reality, like what is real, what is not, what's safe, what's not. And I just want to put it out there too that if you are brand new to newborn photography and you see a picture of, like, even Tenielle and I were talking about this, like somebody posted a picture of a baby on a piano, I'm like, that would have been a composite.
Yes.
And she's like, okay, I hope so. And I'm like, yeah. And then this baby was posed on this. And like, that would be a composite. And the thing is that if you are not part of this industry, you might think, okay, that baby is literally on a piano and nobody's around. Yeah. So it's important to know that, okay, if a baby is ever on a high surface, there is something getting photoshopped out of that picture.
Yeah. Yeah, absolutely. And that's the beautiful illusion of photography, but it's also the point where if you don't know or you haven't been trained, you think, oh, I can repeat that, and you're not doing it properly.
Exactly.
Yeah, for sure. So training is very important, especially in this industry, because there's some fabulous photos that come out of it. And the editing piece is what's important, right?
Yeah, absolutely. And it's funny, like I remember back when I was learning newborn photography, and I had a really good friend who was naturally just gifted at it, but she had never had any formal training. And so I remember this was literally like I think before I even technically started, and she sent me a video of her posing a newborn in the froggy pose, and totally unsupported, totally just like literally by himself balanced. And she's like, yeah, it was so cute. I finally got, I got him to do it. And then he just kind of rolled over, and me and the mom thought it was so cute. And I was like, oh, okay. And then I found out like that's a really big no-no, you know, and then I've obviously been educated about everything safety wise as far as newborn photography, and I always think back to that. I'm like, she didn't know.
She didn't know. Yeah, that's right. And so I think that's the whole point of the course, is that we're not coming at this necessarily. It's not a matter of like bashing somebody, or it's not a matter of right and wrong. It's a matter of making yourself educated, the more education you have and the more information you have, the better decisions you can make.
Yeah.
Right?
Yeah.
And so it's also not really helpful to like go online and like bash somebody. That's so unsafe, you know?
Yeah.
So that's not a helpful thing to do either. You always look at it and you go, is there a better way to do this?
Yeah.
Right? And just because somebody else did it this way doesn't mean you have to repeat it.
Yeah, exactly. Yeah, always choose the better and safer option, even if it takes you a little bit longer.
That's right.
And you will feel better about everything at the end of the day, and just have that confidence knowing that you can tell parents that I have trained, I know how to do the safest way possible for the pose that you want. And if it's a pose that you're not comfortable with doing, just say, honestly, I'm not comfortable doing that yet.
Yep.
Especially with, maybe their baby is wiggly or, whatever. You can always say, I'm sorry. We're going to have to move on to a different pose that is safer. And just use that terminology. You don't have to give a big detailed answer. And also that comes down to like consultation, like way before they ever show up to the studio, talking about what you're capable of, what you're comfortable doing, what you will not do, and also communicate, find out what the family is comfortable with. Yeah,
and definitely even in my industry, we see this all the time, and the best healthcare professionals are the ones that say they don't know when they don't know. If you're pretending you do know what's happening or something, or you're seeing a red flag in some sort of way, the best thing you can do is say, I'm not entirely sure, I don't know what's going on, but I'm going to refer you for more testing or more things or stuff like that. So if you don't know in your industry, say it.
Yeah. There's nothing wrong with being honest, however discreet, and just make a recommendation. You know what? And even like this even goes towards like if you notice something a little different about the infant that you're posing and it's of quite concern to you, then just mention, when's their next pediatrician appointment?
That's right.
And they might say, oh, it's in next week. Then you could just say,
perfect.
Awesome.
Because
the pediatrician will catch it.
Yep, absolutely. Yeah, it's definitely not your place as a newborn photographer to be mentioning anything of medical or changes to the parents, right? It's important that you know about it, but it does not make you a medical professional, and it does not allow you to start to diagnose things.
Yeah, exactly. Exactly. Remember that. Yeah. Okay, Nicole said there's a photographer near me who does unsupported froggy and posts it and deletes any comments I mention how unsafe it is. Yeah. That's unfortunate.
It's unfortunate, for sure. I mean, in every industry, there's a bell curve. There's the people that are really good, and then there's kind of everybody that's in the middle, but there's always people on the other end. It happens in every profession, whether you're talking about physiotherapy or photography, you're talking about physicians, you're going to have good ones and you're going to have bad ones. And unfortunately, that is the nature of statistics. There's never not bad people in your industry. And so I know, unfortunately, you're going to see that. And so just don't be one of those people.
Right? Yeah, that is your goal. That is your goal, is to be recognized as one of the safest and one of the most considerate newborn photographers in the industry. Yeah. And we show you how to do that.
Yeah, that's right.
So I'm just going to, we have one more thing that we're going to talk about before we let everybody go. And somebody had wanted to know about posing on the higher tables, and if that can, if she'll be certified for safety using a higher posing table. So I'm just going to mention the different types of higher posing tables. So there's a DIY version that lots of photographers do. They go and get a folding table from Costco, and they, put them together so that it's like massive. Or there are vendors that have designed newborn posing tables that are table height, and they can collapse, they are mobile, they can be taken this in like different places. So those are the two types of table poses that are high off the ground.
Yeah, for sure. So remember what she just said, they can collapse. So again, there's no right or wrong answer here, but the more your table folds and the more compact it is and the easier it is to collapse, the more unsafe it is.
Yes. So you just have to take those extra precautions to double and triple check the safety scenarios. So for instance, there are safety brackets that you can buy as like an extra safety that can connect to the table. So basically if one bracket was to fail, the second bracket would save it. So, and then you can also put reinforcement bars in so that the legs can't fall and collapse. So there's different things that you can do, but if you're not checking those, that's where you're failing. You're failing to protect the infant first and yourself second, because you are liable. And also, you know, like just double, like also I discussed this as having rails of some sort around the table, just because then a baby can't roll off.
Yes, for sure. Absolutely. And it depends on, you know, the older the baby is, then the more they're going to move and all of those things as well. And it is something we talk about. We have a whole ergonomics section. And I would say the main reason why why they would choose a high posing table is to save their back, right? That's the reason why, which is a very valid reason to be able to do that. However, there are safe ways to use the dog bed, and we discuss all of that, as well as some of the things like pre-stretching programs and stuff like that that you can do to prevent it. But I absolutely agree, using a dog bed and bending over or squatting is absolutely horrible biomechanics, and it wouldn't be the best decision.
And I don't know if you noticed a comment yesterday or it was this morning, I can't remember, on the live that I did last night, and somebody said that they had been recommended to use the dog bed and that within an hour their back was in complete spasms. So I just want to specify, you have to use the dog bed correctly. It's not something that you want to be bent over, because of course your back is going to be in spasms, and you don't want to be squatting the whole time either, because then you're going to be having spasms in your legs and your back. So I actually show and demonstrate how to use the dog bed, how I use it. I do not get back pain from it. I do know though that everyone is different. Maybe
everyone's different.
I have several students that are in their 60s and they have had knee surgery and different things, so they are not able to bend over and sit on a shorter stool. So they do need to use a table, and that is totally fine.
It's totally fine.
You just need to go through the steps to make sure that you are double and triple safety, like adding those safety features.
Absolutely. And then, again, we discuss all of that in there, and it's what we call a risk assessment. So you have to consider your personal situation, and everybody will be different. So it's not something you can just say a posing table is safe or unsafe. That's not the answer. The answer is a lot of different things, and there's a lot of different reasons why. And so you'll make the decision for you based on what works for you, and then you'll take those extra steps.
Exactly. So I'm just going to see if we have any more questions before we go. But it doesn't look like it. So now if you guys have any questions, definitely pop them in and Tenielle will answer them. Or I will if I can. And I'm just going to briefly mention the live that I did last night. So if you missed it, the replay is going to be active for 24 hours. It's an editing boot camp. It's just teaching you as much as I can within the hour. I did spend an hour and a half because I tend to go overboard. And I did cover editing in Adobe Camera Raw, Photoshop, and then eVoto, and I did give some free gifts. One of the free gifts was a $50 coupon code that you can put towards the early bird sale on Monday for the safety course. So if you want to save that coupon and use it for Monday, do it, but it is going to expire. So the early bird sale is going to be on for the entire week next week, starting Monday, but that $50 coupon is only going to be valid for Monday. So don't wait and then forget. Make sure that you put an alarm in your phone and a reminder, and definitely make sure that you use it when you can use it, and it'll be valid until the end of Monday at midnight.
Awesome. Great.
Cool. So I'm just going to see, I don't think we have any other comments or questions. Thank you guys so much for joining us, everyone who watched us.
Mm-hmm.
We are going to post this video to YouTube, and if you're watching on YouTube, definitely comment below the video if you have any questions. We will be posting all of the links for the newborn safety course. I'll post the coupon code in the description as well, and I will also link Tenielle's clinic and her Navasas website.
Mm-hmm.
And also you can, if you want to do some extra digging on me and find out who I am, I will link Raindrop Photography as well as Mom Tug Educate and all of our socials on there.
Awesome.
Okay.
Great.
Thank you guys for joining us live. We really appreciate your time. And we do have one extra comment. You're welcome, Amanda.
Welcome.
Thank you everyone who joined us. Okay, you guys have a wonderful day.
Awesome. Bye.
Bye.